Hi, everybody. This is Jason Wu with the Human Services Council. Thank you so much for joining us this morning. For those of you who don't know, HSC is a membership association representing about 170 human services providers in New York City and New York State. Our core work is advocacy on behalf of the human services sector, making sure that we're strengthening nonprofits so that they can continue doing the important work that they're able to do, especially during these times. HSC, if you're not familiar with us already, over the past couple of weeks has become a COVID-19 resource for many of our human services providers and partners. We host morning calls twice a week at 8 a.m. on Mondays and Thursdays. Please feel free to reach out to me if you are not familiar with them during these calls. We oftentimes will share updated guidance, information that's helpful and hopefully important for human services providers, as well as advocacy actions that we are starting to take with the city and the state. We're also happy to partner with organizations like SpaceSmith to provide information and other resources to nonprofits as they are trying to figure out how to both respond but also start returning to work as more and more of these orders get lifted. So without further ado, I want to introduce Ambar, from the design principal at SpaceSmith, who will be leading their presentation today. Just as a reminder, everybody is currently muted, and you will not be able to unmute yourselves until we get to the end of the presentation. If you have any questions, please feel free to type them into the chat, and we will make sure to start going through those questions first when we start the Q&A section. Again, thank you, everybody. Amber, I want to turn it over to you.
Hi, thank you, Jason, and good morning, everybody. Thank you for joining. We have about 70 people who RSVP'd to this conversation. I have a short presentation divided into 3 buckets that we'll get into shortly. And I very much look forward to your questions and discussion at the end. As Jason said, please go ahead, and as I'm going through, if you have any questions, please put them in the chat. And I really look forward to the conversation afterwards, as I said. I'm Ambar Margarita, and in addition to being a principal at the architecture and interior design firm SpaceSmith, I'm also a teacher at the School of Visual Arts with teaching critical thinking and evidence-based design to interior designers. So we essentially pour through scientific journal articles and evidence and the impact on humans in the built environment. I'm also a certified WELL-accredited professional. WELL is a building rating system for interiors, housing, new construction, existing buildings, renovations. That's all about how the built environment impacts the way humans feel, behave, and our health in the built environment. Also all based on scientific evidence. So that said, I'll get started. Great. So I like to start with what we know. It's constantly changing, but if we are looking at New York State and a reopening strategy, which is what we're largely talking about today, we know that Cuomo has plans to reopen businesses in 4 phases, meaning in-person businesses. I know many of you are still running your businesses. I am surprised. One thing I failed to mention is that SpaceSmith and myself work a lot with nonprofits in New York City. We are currently in touch with all of our nonprofit clients with active or inactive projects, and I am just amazed at how they have found ways to continue providing services to the people that need them most at this time. So congratulations to all of you who are already doing that. I am just absolutely blown away. And this is about getting over the crisis mode and looking at the new way forward. So that said, 4 stages for reopening. So first, essential services, then professional services will reopen. Then we're talking about a stage 3 for restaurants and hotels and the hospitality industry in general, and then arts, recreation, and education. So the final stages, those spaces that are have a high density, meaning many occupants or people in a small or a large space. From the CDC, we know that these are what the steps that they recommend. So a space hazard assessment. Where are your hazards in terms of transmission? Conducting daily health checks, wearing face coverings, implementing social distancing policies, improving building ventilation, which we'll talk about, and improving building cleaning methods and frequency. So these are just two known things that I'm sure you're all aware of. The way we've divided this presentation and the way we're approaching it is in 3 buckets. So we have, you could call it team leads for each of these. So you have your human resources, your facilities and building operations, and then there's a design component or a redesign, a look at the space. We'll start with human resources. So we see this team being responsible for these 5 or 10 or 20, you know, they all get higher as you start to delve into these, but I'm trying to make it simple and condensed so that it's manageable. So human resources together with the other 3 team leads would develop policies for enhanced cleaning, changes to workplace design, and new HR policies. So what is your policy about coming into the office, about remote work, about staggered shifts, all those new policies that need to be developed. And communicating these effectively. When you communicate them effectively, you increase staff confidence in their safety, which allows other cognitive behaviors to actually take place. Number 2, understanding which employees need to come back to the physical office and when. We've developed a survey that we've sent out to our staff and to clients. And essentially in this survey, you really want to understand how people are working from home, what they need to work from home more effectively. It could be software, hardware, an ergonomic chair, lighting. It could be all sorts of things. And also who absolutely needs to provide a service or perform a function in a physical office environment, whether this be your current office that's might most likely sitting empty, or it be providing a service to somebody else in person, perhaps. Every organization is different, but the baseline is understanding. So polling, surveying your staff, what they need, who needs to come back, who doesn't need to come back. Also, like I said, understanding what they need to work at home effectively, and then developing rotating schedules for remote and in-person work once we have the go-ahead to do that. And then developing strategies for visitor management. Are you going to accept visitors? If you are going to accept visitors, which many of you I know must, because a lot of your service is in person, how do you do that? And how do you keep your employees safe when you do that? And some of this has to do with space, how you move around space. Maybe you need to add something to provide safety measures. So for human resources, what we see is that the team leads work in partnership. Everyone works in partnership with human resources to develop these specialized questionnaires to collect and analyze the data, assist in the development of all of the firm-wide protocols, and then all the team members support human resources regarding change management messaging. So you might have someone who is in charge of the change management messaging. This could be a consultant, or you could point someone in your firm, in your organization, to take care of the change management messaging. What do I mean by that? Any new strategies that you develop, whether they be physical, new behaviors within the workplace, or new behaviors within email management, something as simple as if you're having problem with communications, always assuming good intent. For example, when people start to get short with their emails, it could be very, very simple policies that just need to be messaged, or change management with regards to the remote working schedules or the staggered schedules. So change management is all about communicating and then also receiving feedback so that you can adjust. So it's good to have a team leader for that type of communication. This is the next one. So now we're switching to the building operations. This will be very different for different people. Some people lease one floor in a low-rise building. Some people lease 1 or 2 floors in a high-rise building. So some people own their building and operate their own buildings. So this will be different for everybody. But The idea is that you understand the building access protocols. Now here we are talking about what we can control. Many of us cannot control the way our staff gets to the building, although there are some strategies for that as well. But for now, let's talk about once you get to the address, how you get into the building and what happens there. So how do people come into this building? Are there automatic doors provided at all entry points? I'm talking about touchless doors and technology. Is access to the building staggered? So here you can either, if you own the building, you develop the staggered entry protocols into the building. This floor, according to the capacity, enters at 9 a.m. This floor enters at 10 a.m. This floor enters at 11 a.m. And that takes a little bit of strategy. This image you see in the upper left is actually a building lobby. The colored rectangles are the elevator banks, and then the lines, the dashed lines, are actually showing the sequence of the people entering those elevator banks. So whether you're in the low rise, mid rise, or high rise floors, what door you should use, and the floor markings that show a 6-foot increment, a 6-foot social distance. And then you can actually see how many people can queue to enter this building. Because as point number 3 says, how does your vertical transportation work? Will you be staggering entrance into the elevator banks? How many people are allowed per elevator? Will there be somebody who is directing people into the elevator and saying, okay, only 2 people, that's it? Or will there be floor markings, as you'll see in the next slide? There's also talk and research about flushing elevator cabs with fresh air between trips. And then making sure that the building and the office capacity limits are based on the 6-foot rule, which we'll cover in a case study in a couple of slides. Here we have images about what an elevator inside could look like. Some people are recommending that the markings on the floors are actually show people facing the walls. I know this is all completely bizarre and we're all, rolling our eyes, but really we're just trying to do the best to reduce this human-to-human transmission. So what we see as a responsibility for building operations is the developing and the rollout of protocols for things like a temperature scan. Ideally in the future, it would be, viral screenings upon entry. This is pie in the sky thinking at this point in America. But also evaluating things like the air distribution and filtration. So for example, MERV filter. So how you have your window unit or your air conditioning unit at home, it usually has a thin filter. Well, think of the mechanical units within a big office building or a residential building. They usually are larger mechanical, commercial units, and they have very, very large filters. Well, in hospitals, those filters, MERV is the type of filter, and MERV 13 is the type of filter that is used in a hospital. It filters out the finest particles from the air. So while COVID-19 is a very, very small particle, it usually attaches to other things like fluids, and then it becomes a larger particle. So MERV 13 can screen out that particle. Usually commercial buildings have filters that are under MERV 13. So it would be something like a MERV 10, a MERV 9. So the idea here is that you evaluate your systems to see if you can insert if it will allow a higher grade MERV filter. And then developing signage to ensure implemented strategies are being communicated to staff. So, or the people entering the building, floor markings, wall signage, encouraging new habits within a space that they're already used to. Developing an enhanced cleaning protocol with an emphasis on high-touch surfaces. So a high-touch surface inventory is very important. High-touch surfaces are things like doorknobs, elevator buttons, our phones, our keyboards. So there's the public high-touch surfaces, and then there's the personal high-touch surfaces. And you want to develop an inventory for both of them, really. But then you also want to have different people responsible for those high-touch surfaces. So identifying what those are is the first step, and then identifying the cleaning schedules and the methods for each. UV cleaning devices are something that has been out on the market for a long time. You can use them in fan coil units in your mechanical systems to decrease mold, mildew, viruses, airborne bacteria. But now they're also producing some handheld ones. So if you are going to look into those, just make sure they have the output that's stated here. And there's also electrostatic cleaning equipment, and there are also products that are antimicrobial, things that can be applied to surfaces that are antimicrobial, like Microban. There's a lot of talk about how copper, so materials that actually have copper or are pure copper, the virus only lives on that for 4 hours, as opposed to stainless steel, which is 10 hours, and plastic is much higher. Another point for building operations is to keep a stock, maintain a stock of personal protective equipment and tissues, no-touch trash cans, automatic hand soap dispensers, hand sanitizer, you know, all of these things that anybody in the building might need to either clean their personal space or also clean your building staff to clean the public space or public domain. So moving on to design. These are some questions that spatial designers are asking clients. And when we look at your floor plans, when we look at your space, we ask these questions. The first step is, how is it currently laid out? Can you have 6 feet between people? What do you do about conference rooms? How much space does your office have in total? Can it be reconfigured? Can we remove seats here and there to create adequate spacing? Where can signage be placed? And then lastly, there is sensor technology. There is sensor technology that exists that we have piloted in our own office that is a very small size. They can be applied to the bottom of chairs, bottom of desks. They can be applied to the door frames in conference rooms. And this sensor technology basically is an occupancy sensor. It can be tied back to a floor plan and an app on individual people's phone or computers. And it basically offers updates on the density or where people are at any given time within your space. It can be non-ID, meaning that you don't know who it is that's there. You just know that there are people there. So for example, if your new pantry or copy room capacity is 1, before someone gets up to go to the copier, they can see if there's already somebody there. Obviously you can walk over, but it depends on how large your floor plate is, right? If you have a large space, people might not want to waste the time to go and then just wait in line. You also want to reduce people waiting in line. You want to reduce the density anywhere. So basically sensor occupancy technology can allow for people to be informed about who is where at what time, and then you can actively avoid certain spaces. It also gives you, it was originally designed so that it could give real estate managers an idea of how their space is actively being used. When you usually ask people, I think before COVID, we would ask people when we're interviewing them in the early stages of a project, you know, how much space do you need for your staff to work? And they would all say, you know, we need 40 workstations and we need 20 private offices. Everybody is here all the time, which is interesting because a lot of people are, you know, caseworkers or social workers who should be with their clients, providing service to their clients. And then when that's anecdotal information, but when you actually use the sensors, you get actual data and you can see that the data is very different from the anecdotal data that is given by the end user. So in terms of design, the next step is if you have any projects that are in the design phases right now, this is a perfect opportunity to hit pause and reevaluate. Reevaluate how that design will work in the future. Reevaluate how all this money that you're going to spend will work for you in the next 10, 20 years or the duration of your lease. It's also a good time to look at your leases. Reviewing your portfolio. If you have more than one service center, more than one offices throughout the boroughs, identify opportunities for how your new strategy can be applied to the entire portfolio, or even have a few test cases if you can. Identifying total occupancy by floor plate, and defining the quantity of specific positions or people that are needed on the site. So you can identify the total occupancy in multiple ways. If you just want to look at the plan, at your floor plan, or if you just want to even walk around and count empty chairs at this point to understand how many people can be on one floor plate at a time. And then assess the density level. So if you have 40 seats, but with the 6-foot office, right? You draw a 6-foot circle around the seat. I'm going to show you an example in a minute. You can assess whether you can meet these physical distancing guidelines. So if you draw a circle around a seat and then your other seat is more or less than 6 feet away, if it's less than 6 feet away, then you can't have somebody sitting next to that other person. So you can assess your density level. And then determine sequencing and work rotation like we talked about with HR. So if your space doesn't allow for everybody to be there at the same time, what will the work rotation be? Designing the signage and placing the signage. Addressing the facility flow and circulation areas. So can you do a loop circulation that's in only one way in your hallways, your corridors? Can people be only walking in one direction and still make it to every place in the office? If your corridors are less than 6 feet wide. Ideally, they would be over 6 feet wide, but that's not how spaces are designed, especially in New York City. And then address facility flow and circulation, we talked about that. And then finally, modifying the individual work points to comply with the physical distancing norm. So what can you do in one person's work area to comply with the 6-foot rule? So this is an example of a floor plan, including furniture. So I am assuming you can all see my mouse. And this room up here is a small meeting room with a table and 4 chairs. So that's what that looks like in plan. And on the lower part of this plan in the center, you see that there's a set of double doors. This set of double doors walks into a reception area. All the dots in blue are chairs in the reception. This is a human service center. This is actually a foster care visiting area on the upper left. And they provide a lot, so foster care visits, foster parent training, meetings on the room in the lower left. And on the lower right, there is a medical suite for checkups, documents, all sorts of things. And then the portion that's grayed out is the office portion. And we will discuss office in the next slide. So I just wanted to show this part first. So normally there are 14 seats in this reception area. Somebody would walk in through these double doors. They would be greeted by the person in the room on the right. And this is already great for social distancing because this person is actually behind a piece of glass with a small transaction window, very much like at the bank. And then you walk into the reception and you wait, depending on where you're going. And there's someone else, there's another security supervisor sitting in the reception area, or an assistant sitting there. So we have to protect this person, and we also have to protect the visitors, right? So before the redesign, there were 14 people in reception, 48 people over here in what we're calling counseling or foster care visiting, right? So each of these counseling and visiting rooms allowed for 4 people. And then in the medical suite, we have a capacity of 10 people. Now, when we look at this redesign, this is the capacity, this is the same floor plan. This is the capacity after, when we started looking at it in terms of a physical distancing and some other strategies. The reception holds 9 people, before it held 14. Counseling is also slashed by half, and the medical suite only loses 2 because that's already pretty generous. So what we've done here is we've done arrows for how people are supposed to enter and exit. And then we have circle markings on the floor. These dash circles are 6-foot radiuses. So this tells people where they can stand and where they can't stand, where they can sit and where they can't sit. So we've removed half the chairs and we've added the circles. So the first step is reducing the seating capacity. You can also add screens as the picture illustrates. Placing signage to encourage healthy habits, but also to keeping the distance. So there's signage that's already out there. You can get signage custom designed, or you can Google social distancing signage. There are so many people that are making great looking products for this right now. And then adding a reception shield if you don't have one. In this case, we would add a shield around the person who's sitting in the reception area. Then when we look at the counseling spaces, if you remember, those spaces went from being in capacity for 4 people to being in capacity of 2 people. There should also be signage in those rooms, outside the rooms before you enter, and inside the rooms that tell people where they can sit at a healthy distance. Now, if these are individual rooms, you might also want to amp up the fresh air intake and exhaust and return out of these rooms, for example. You will want to apply a rigorous cleaning to all of the surfaces in the room, every single surface, the fabric on the chair, the floor, the walls, anything that people will touch. This is a virus that is transmitted through the built environment as well. Humans deposit it on the built environment and pick it up from the built environment. And then closed rooms as well. This went from a capacity of 8 to 4 people. The pantry that's outside the closed room, 1 person at a time. On the lower left, I have an image of a touchless entrance. Basically, this is something that can be tied to doors. You have to have a low voltage wire that goes to these doors, and it's new hardware for the doors. And this has a scan, so it's like a finger scan, very much like if you have an iPhone. It's very much like that, except it's touchless. You just have to reach your hand in. And there are other models that might be even better than this one. This is just an image example for the touchless entry. So that's the Human Service Center. Then when we go to the office floor plan, this is the floor above, so several floors above the service area. This is before. Before, you had a total floor capacity of 133 people. We get to that by counting absolutely every chair provided in the floor plate. And then we divide it into areas. So the workstations have a capacity for 75 people. This is an all open work floor plan. Then the meeting rooms have a capacity of 36. There's counseling rooms within the work area, capacity for 11 on the floor. And then there's a pantry with built-in seating with a capacity for 8. The reception area is up here, upper middle. This is the elevator. And this building actually has 2 sets of stairs, which we'll talk about encouraging stair use. So there's a stair up here and a stair down here. This floor plan shows workplace group A. So we've divided all of the seats into who can come in shift A and shift B. Shift A might be Monday, Wednesday. Shift B might be Tuesday, Thursday, whatever your organization decides. The reception area is now, so we went from, just high level, we went from a capacity of 133 people on the floor to a capacity of 66. So if we begin with reception, there's 2 people allowed in reception. There's a sanitizer station right at reception. So every single little red dot on this plan is a sanitizer station. And 4 major points in circulation, in the pantry, in the copy room, and at the reception area. The circles show the queuing for the restrooms. Restrooms is something that we really have to talk about. Do you keep the doors propped open if there's enough privacy so that you reduce that door handle touching, right? That's a high touch surface. Do you have people queuing outside the restroom? If you do have people queuing, floor markings, you see those circles, those red circles, floor markings to where people should queue for the restroom. The workplace are all these pink seats. They show a staggered workplace design. The chairs have been removed from the other desks. And you see that the 6-foot circle is calculated based on the middle of the circle and where that chair is. So we've reduced that capacity to 39. The meeting rooms, we've also removed the chairs, half of the density. And then the pantry, very, very reduced. From 8, we went to 2, and this one is fairly generous. If it was a smaller one, there would be 1 person at a time. But there's another idea when it comes to pantries, the consideration of distributed pantries. This image is showing a very nice one. You do not have to have it be this nice. It can be as simple as wherever we have these sanitizer stations, it could be a small refrigerator, a microwave, and maybe a touchless water dispenser like the ones that you see at airports where as soon as you put your own bottle, you encourage employees to bring their own bottles or you give them their own bottles and it's a refilling station. You want to reduce, I hesitate to even say microwave and pantry, but I understand that a lot of people who work in human services and even architects, we bring our own lunch. Everybody brings their own lunch. And You also want to reduce people coming in and out of the building, as you saw the queuing to get into, especially if you're in a high rise. So providing places for people to have their lunch. The idea is to decentralize the pantry so that you have multiple spots where people can have their lunch and their water. However, there was a study that in a, what do you call it? A food service, not a food bazaar, you know, those like places where the food is weighed and you pay by weight. They put, this was a study in China, and they put glow-in-the-dark paint on a gentleman's hand. They had him go into the store and serve himself his lunch. And then they followed the 15 people that followed this person, get their own lunch. And then they put them all in a room. And then they asked them all they shut the lights and they asked them all to show their hands. And every single person in the room had glow-in-the-dark paint on their hands. So if we were thinking that that was the coronavirus, that would have spread to everybody in the room. Let me see, I'm getting a message here. I'll answer that later. Thank you for your question. Okay, so I was talking about pantries. So when we think about a communal coffee pot, everybody who's touching that communal handle will potentially be exposed to the virus from somebody else if they are in that work environment. So just to be thinking about the built environment and every single thing that we're using, plastic being one of the things that holds the virus for the longest amount of time. So I just wanted to put that out there. So I think you all understand, and I can answer questions about this later, but this is group B. So I'm gonna go back to group A. The floor plans are very similar, except for group B shows another set of workstations. So the ones that were in group A are now not there. The ones that are in group B are the stations that weren't in group A. So you still want people to sit at their desk. You don't really want people to share desks at this point. You want them to have their own things. You want them to be responsible for their own things. You want them to clean their own things. But so this is a strategy for group A and group B. And let me see if there's anything else that I'd like to mention. And then adding panels between desks, yes. So there are a lot of products out there that are flooding the market now about, panels. We've worked so long to get away from this high-walled cubicle office environment. And I don't necessarily think that going back to high cubicles is the right solution. And there are a lot of these temporary panels between desks or screens. I've seen them made out of cardboard for $30 a screen. And I've seen them made out of plexi for $700 a screen. So there are a lot of different things a lot of different products that can be purchased for privacy and for reducing the airborne transmission of the virus. Not 100% effective, but still a good thing. And the final thing I'll mention on this slide is the one-way stair. So if you are going to encourage use of the stairs, make sure you're using them in one direction, meaning they're either used to go up floors or exclusively to go down floors. That way you don't have people passing each other in a fire stair, which is typically not very wide. So finally, there's this recovery readiness roadmap that I really like. This is by Cushman and Wakefield. And they say these are the 4 steps, which is basically what we've been talking about. I like the way this is very concise. First, you assess everything that we've talked about. So everything is interconnected. The remote working, who needs to remote work, who can remote work, who can work from home. Then that leads back to what your demand for space is. And what are your cultural priorities as a firm or as an organization? So do you need to be together for certain activities, or can you keep your culture going online? And also so there's internal culture and then there's external culture. So all that can be evaluated. Then you can evaluate your portfolio, your lease, which we'll talk about in a second, building readiness, supplies, PPE supplies, and any workplace technology at home or in the workplace. Then you plan, what are the custom solutions and your priorities and the workplace needs? What is your phased reentry strategy, your change management plan, your protocols? Are your stakeholders, meaning everybody, your everybody knows who their stakeholders are. I'm sure a lot of you have boards. Your stakeholders are your boards, your employees. It's very important to have your employees aligned with any strategy that you have. And then your future vision. Are you going to continue to provide some services remotely? Some clients are finding that this works great. What do you need your space for? So plan what the future of your organization looks like. Space planning, the 6-foot office plan, which is what I was just showing you. What does the new, a capacity for 133 turns into a capacity for 66. Infrastructure solutions, IT, hardware, software, technology, and a sourcing plan. So sourcing all of these enhanced cleaning things, anything else that you might need, it might be technology. And then documenting. So for us, that would be, strategy plans, documented in writing, documented in signage, documented in drawings of your office. And you basically document everything you've assessed and you've planned, and then you implement. So how are you going to execute everything that you've discussed in the prior phases? This is how we can help. We have online surveys, as I mentioned, to evaluate your current work process, but also evaluate how you would like to work and provide your services in the future. Space assessments, including the density studies, similar to what I showed you. Material recommendations, what areas can be changed in terms of materials? What are your high stakes environments, high touch places, all sorts of things? What are cleaning products that will not be harmful to your team? So all of these things we can consolidate for you. Landlord real estate evaluation. So how can you access your building? We are working with a few landlords in New York City to provide the elevator protocol, the social distancing cues, the floor markings, the plans, also the signage and graphic design. We can design custom signage or help you find existing signage and where it should be placed. Very much like as architects, we plan the exit signage in a building according to code and according to how people in a state of emergency need to exit the building. All those exit signs that you see, we plan those and where those need to go according to how people circulate and navigate the space. Your signage should be planned in a similar manner. It should be very organized. It should be intentional. So we can help you with that. And then we also have real estate partners who can help you negotiate rent relief with your landlord now, restructure your lease for more favorable terms, and give you alternate space options to consider. If that is in your plate, I'm happy to refer you to real estate partners. So these are our two, so that's my contact information, heymargarita@spacelit.com, and then my colleagues' contact information as well. And the end of the presentation has a few links. I have a few PDFs that I could also send all of you for further information. And we get more information and products and many things every single day. So I'm happy to share that with all of you. I think that it's a very, very important time to have a conversation, just have everybody be banded together and us offer our expertise and you also offer your expertise to each other. I think it's a great time for that. And that's all I have to share. I look forward to answering your questions now and also to learning from you. I admit that we don't have all the answers and that the answers are changing all the time. So that's all I have. I hope that was helpful to you all.
Thank you so much. That was great. So just to confirm, we can share the slides after the presentation with the people that registered for the event. I'm also currently recording it and would be happy to share the recording as well. We did get a couple of questions through the chat. So I'm just going to start reading them off, if that's okay. And of course, if the participants have any additional questions, please feel free to type them into the chat and we'll try to get through as many of them as possible. So the first question we received was, what about bathroom design and monitoring? So I think that was a little bit earlier back in the presentation. And whether a design firm like yours can provide cost-efficient solutions. Yes.
Yes, like I said, a perfect example is the screens at workstations. There are cardboard solutions that are readily available and are designed as screens that will stand, and they are $30. We also got another solution that was $700. So there's a wide range. So short answer is yes, we can find cost-effective solutions and recommendations. And about the bathroom, it's all about assessing how your current bathroom is designed. So do you have partitions that go all the way to the floor? Most likely not. That's a very European thing. So what is your new capacity in restrooms? Do you hire cleaning staff that is the concept of the bathroom attendant who is constantly cleaning the bathroom? Or do you have an updated lease agreement with your landlord where their maintenance team is responsible for cleaning every hour, or whatever you agree to depending on your capacity? In terms of redesign, there are simple fixes like just countertop soap dispensers, automatic soap dispensers. You want to reduce the amount of contact. Ideally, you would have, one thing I forgot to mention is that paper towels in a bathroom setting and in a pantry setting have been proven to be a lot more effective than hand dryers. Paper towels actually continue to wipe the microbes off of our hands. Hand dryers, if they do not have, especially those high-powered hand dryers, if they do not have a filter in them or a UV light, they are not cleaning the air that is being thrown onto your hands. So they might actually be putting more particles onto your hands and as they dry your hands. So paper towels have been proven to be more effective. Those C-fold towels where you can take one and not touch the rest. We're all think like a hospital. You do not want to contaminate anything. And then it's all about the bathroom capacity and the queuing line outside of the bathroom.
Okay, so the next question we received was, our staff's cubicles are divided by cubicle partitions. Would this be okay even though they're not 6 feet apart since they're facing walls? And density monitoring is important, so could you also share some of the technological tools, especially if they're requiring the purchase of devices? Are there a list of options that they could consider?
Absolutely, absolutely. These are usually, so the thing about the technology is that it's usually a subscription-based service. It's 2 steps. It's a hardware and software, and it requires some programming. So each sensor has its own IP address. And that IP address is tied to your floor plan. So when I place, let's say I'm the installer, and let's say this coaster is a sensor. This sensor comes in its own little box and it has its own IP address. When I place it under this table, let's say it's a seat in a conference room, or let's say it's the door, because you can also put them in door frames. Let's say it's the door frame to the bathroom. I have to make sure that when I'm installing that, I am programming where I installed it on your floor plan. Because if I don't do that correctly, it will not give you the real-time data. So that is a sensor, and yes, there are many manufacturers out there, and I can provide a few. If you remind me that, I'll provide that with the software, a couple options. But it's typically a subscription agreement, so it's not something you can do on your own. I just wanted to clarify that. And then the other question was about the cubicles. I would look at your cubicles. Are the people in the cube? First of all, what is the cubicle size? How tall are the partitions? And where are the people facing? Are they facing each other, or are they facing each other's back? Right? Because you have to see what the particular arrangement is. But I'd have to have more information to answer that question. But those are some things to consider.
Sure. It sounds like the cubicles are facing walls, but they're not 6 feet apart.
Okay.
So the next question we received was, are there any recommendations for cleaning or desanitizing fabric chairs? The organization has multiple mesh and fabric chairs in conference spaces and some offices, but it might be difficult to replace all of them.
Right. So I would focus on all of the plastic parts of the chair. I would focus on the arms, the back. You know, if you approach that chair and mirror all of the the ways where that someone would approach the chair and actually sit in it. What does that activity look like? Then you see all the high touch points in the chair. So if the back is upholstered, then you do, a lot of times people pull the chair by this part to sit in it. You're definitely going to want to clean that part of the chair. You're going to want to clean the arms. You're going to want to clean the bottom part of the chair. When people pull it up to approach the table, you're going to want to get all of those parts of the chair, even the base. I mean, the virus is also picked up on the floor. Now, if your office space has been empty for a while, the virus is probably dead. It lives on fabric and plastic the longest, but I think it was 23 hours or something like that. I was just reading a scientific study about it. In terms of the fabric, as designers, when we're specifying fabric, there are certain fabrics that are bleach cleanable, but it's with a diluted bleach solution. There are other fabrics that are not. So it would really depend on what fabric you're talking about. You can always try with a diluted bleach solution and clean it that way. And you can also provide wipes in conference rooms. And if you choose to keep all the chairs, have people wipe down, very much like a yoga class where before and after you wipe down your own space. That's a new habit that people will have to get used to, but it's another one that you can post signage for and implement. So clean before and after. You want to clean the tabletop, the table edge. You want to clean everything.
Great. And the next question we have is, how do you handle an older building with an older elevator in order to comply with the social distancing guidelines, especially when you have clients with mobility limitations?
You put one person at a time in the elevator. You stagger and you schedule their visits. Think about it like if you've ever taken your family to Disney or any theme park where the most popular rides get ticketed and timed entry. Think about it like that. You can even consider having an elevator attendant or that concept where somebody is there. Maybe it's a rotating shift. Somebody is there to help people push the button for people and take people to their floors. Or if you are in a low rise, maybe the elevator is only for people with limited mobility to use, and everybody else uses the ones. If you have two stairs, this is the ideal situation, pie in the sky. If you have two stairs, one is for going up, one is for going down.
All right. So it looks like those are all the questions that we have so far. I'm going to just give it a couple of minutes in case any new questions have come up. Please type them out into the chat and I can read them out loud. Otherwise, I will be happy to share the presentation as well as the recording of this presentation after the meeting. Okay, it doesn't look like any additional questions are coming in. Oh, sorry, never mind. So a new question just came in. Are you designing conference spaces that support both virtual and in-person attendees?
So that's a great question. And we're looking at this a lot in terms of education for how we in the future, if we want lower density classrooms or meetings, how to, I need to close the chat because I get distracted. Okay. How to have a team that's in person and a team that's not. This is very, very difficult. Yes, we can design. So let me answer the short version is yes, we can design them and we have designed them. there are room designs and there's special AV software that's very expensive, or we can think of a way to redesign this, but the ones that I've designed are, you know, in the ideal world, you have a table that's a half table. So if you have a rectangle, ideally it's a boat shape, so it's kind of a rectangle with an arc so that people are sort of arcing at the ends. And then you have your camera screen in front of you. You have your camera and the screen in front of you. And then essentially nobody in the physical space is facing each other. They are all facing the camera, and they have screens in front of them, and everybody in the camera world appears in that screen that's in front of them. So it requires a large screen setup so that you can see everybody's face very large, you know, in a large format. And that is the most effective. If we do what the cheapest solution, the fast and cheap solution for a large meeting, let's say it's, depends on the number of people, but if you go above 4 people and you have let's say you have 4 people in the virtual world and 4 people in the physical office, and you have a small room, you want to place a camera and a screen on the wall, and you want to have everybody as close to the camera and as like you all are facing your camera right now, you want to have everybody facing the camera, a full frontal view. Now, if it gets larger than that, it starts getting harder to hear people and harder to see people effectively. So you want to plan for that. Like I said, you want a wider range camera, you want everybody to be on the same side of the table, and you want everybody to be talking, engaging with the people on the screen. So there are ways to set this up, and there are many solutions for it as well.
So it looks like we received a follow-up about the sanitizing procedures for fabric or mesh chairs. Somebody was asking whether spraying Lysol spray would be effective in sanitizing them. It seems like another person was suggesting potentially spraying it with alcohol if individuals were worried about using bleach. Just wanted to see if there were any thoughts on either.
Yeah, actually, one comment was from my colleague, Katie Flamia, who has designed hospitals for a long time. And she said that definitely use alcohol to clean the fabrics.
Okay, and is Lysol spray, would that also be effective?
I would imagine, but I haven't tried it myself, so I won't comment.
Okay, and I think this will probably be the final question as we are close to time. Would you be able to speak a little bit more about corridors in the office? If the point of entrance is the elevator, would the circulation be a one-way loop type of circulation? What are your thoughts to minimize contact between people while using common paths in the office?
Right. So one question is, or one assumption is, as soon as someone leaves their personal workspace, have them wear their mask or ask them to wear their mask at their desk the whole time. So in this floor plan, we actually designed it this way, where the elevator is up here, you come in through this door, and there's a loop circulation. So we could make this a one-way circulation so that people know if they're approaching somebody's back, they stay 6 feet away. And floor markings could be placed here. So you could do something similar in your office, but you would have to analyze or walk through your space to see if this is possible. In some spaces, it might not be possible. So encourage people to wear their masks and not touch anything when they're away from their desk.
Okay, thank you so much for your time today, and thank you so much to all the participants. Again, I will be sharing a recording of this and the presentation afterwards. If there were any additional questions, please feel free to send them directly to me at info@humanservicescouncil.org. And again, thank you, everybody. Have a good day.